Hi, all my friends. How are you? I hope all of you is good and in better health and your family. So this is video is part one of a series of videos. Inshallah, I will tell you about it the next week. Another one. This is part one. The next part two is the next week. Okay. So this is video especially for nurses who is planning to come to UAE here to work here in Dubai or Abu Dhabi or anywhere, just for hospitals as a nurses. Okay, so this is Marwan from Egypt, just a nurse here working in emergency department in Dubai Health Authority. So I will tell you about some interview tips because some friends asked me about what is the type of questions maybe will be asked in the future here when they will come here to make interviews with hospital. So I will tell you about first thing the fixed questions like introduce yourself. This introduce yourself, he don't want to know what's your life, okay, where is your parents, where is your family, like that. No, introduce yourself as sorry introduce yourself is to tell the interviewer who you are. Okay, so I will give you example according to me, depending on me. Okay, so my name is Marwan Faraj or Marwan Selmi, 27 years old, from Egypt. I graduated from nursing college from 5 years ago. I have experience more than 5 years in emergency department. Or maybe you say I have been working as a staff nurse in emergency department more than 5 years. I have experience in 2 to 3 hospital. I have certification like in American Heart Association, like basic life support, advanced cardiac life support, PALS, pediatric, like that. You tell him experiences and the certifications and who you are. Okay, this is the first question. This is normal question. The most important point here is don't be afraid, don't be scared, don't be stressed. Okay, interviewer want you to be trust yourself, want someone trust himself, is speaking good, the tone of voice is very good, is high, not low or high, it's just very good and simple. Don't be stressed, don't be afraid. He is a human, he want to know if you trust yourself, because you will be responsible about a patient's life in the future in his hospital. Okay, so the next question: what is the fixed question in all interview? A fixed question like IPSG, International Patient Safety Goals, you must search about it in Google, okay, and study it well, because every interviewer he will ask you about this. This is according to GCI 6 goals. You must say it. For example, I will tell you patient identification, improve communication skills, like that, like that. Okay. Second question is because we are now in COVID-19 session, we didn't finish yet. Okay, so he will ask you about PPEs and hand washing, 5 moments of hand washing, and how to put on PPE and how to put off PPE, like that. Okay, and type of mask, and how to hand wash and type of hand washing. All of that you must study it well, because they will ask you about it. Okay, because it's so important in this time. Okay, so the third question is depending according to your department. For me as ER emergency, so he will ask me about triage. What codes I use in triage in previous hospital? What code? There is 2 codes of triage, Canadian and American. Study it well. Okay. So next question is how to triage the patient. How to triage it. So emergency nurses knows what I said. Okay. So another question is what about basic life support? How to do CPR? Okay, and algorithm in advanced cardiac life support, how to manage tachycardia, how to manage bradycardia, cardiac arrest algorithm, ROSC. All of this you must study it, because you are in emergency department. Okay, according to American Heart Association. So we will move to another department like intensive care unit, ICU. So the second question for you is ventilation is most important the most important thing, they will ask about ventilation modes, ventilation problems, ventilation parameters, and how to connect patient, how to deal with patient, to deal with the ventilation when he give you alarm like high pressure, low pressure. Okay, all of this, how to prepare for central line, how to prepare in the dusk, like that, all of this. Also in ICU also there is famous question like VAP bundle, ventilation associated pneumonia, okay, ventilation associated pneumonia, and COTI bundle, and I didn't remember the last one. Okay, there's 3 or 4 bundles you must save it, you must study it, because I'm emergency nurse, not ICU nurse. What also, yeah, about cases, DKA, diabetic ketoacidosis, and ABG, all of that you must study well, because this is important question, and this is the basic of ICU. OT, operation room, operation theater, they, there is special procedures in every department. Okay, ICU, not like OT, not like ER, not like dialysis, not like NICU. All of this is different. Okay, there's fixed things. Okay, like how to deal with COVID patient, how to deal, what do you know about the IPSG? All of this is fixed, but there is procedures. Okay, like ventilation, maybe not in emergency, dialysis machine, not in ICU. Okay, so they will ask you about quality. Okay, they will ask you about the procedures. They will ask you about infection control, and maybe you will find not one interviewer, maybe you will find more than 2 interviewer, one from education department, one from infection control team, supervisor, general supervisor of hospital, all of that. Most thing I want to advise you about is to don't be stressed, don't afraid, just go, and you trust yourself, you are studying well, you pass DHA, you have eligibility letter, you have everything, you are strong. Okay, so they are human, they want to see a strong nurse in front of them. They want to see you are trusted yourself or not. When you sit, don't sit like this. When you sit, just sit like this, beside the chair. Don't just flex your arm and put it in your knee. Okay, so smile, be friendly. Okay, don't be late. If HR send you a mail to come tomorrow at 11, not to come at 12. Okay, just 11, or maybe less than by 5 minutes, like that. Okay, so this is part 1 of tips of interviews, a nursing interview in Dubai or UAE. So please just subscribe this channel and like this video and share for your friends to let all know about interview tips. Okay, and the next week I will give you another video about this. Made a question with me, and I hope you, all of you, come here and work here. You will have a good chance here. Dubai Health Authority and UAE is beautiful and strong place to increase your CV and to put you on the ladder to next step. Maybe there's some people thinking outside the box, so this is better place to come. So thank you. With you, Marwan Shitiwi from Egypt, working here as a registered nurse in emergency department in Dubai Health Authority. Thank you for your watching again and again. Don't forget to subscribe and like this video. Assalamu alaikum.